Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. Welcome to Monday Health Minutes with Valley Health. We're talking about dementia today. It's a syndrome that can result with diminished mental capacity, enough to affect your daily life, not only the patients, but everybody that surrounds the patient. So we're talking with Dr. Scott Murphy about that today, about the condition and the support around it. Thanks for being here today.
Sure, thank you.
What are some of the early signs of dementia? It can be a little sneaky.
It can be a little sneaky. I will say that a common source of anxiety for people as we grow older is wondering, is this sort of normal aging? Is this sort of a forgetful moment, or is it the sign of something more serious to come? And so, a good clinical evaluation with a healthcare provider can help to differentiate if people do have concerns. I will say, as a few rules of thumb, word finding difficulty comes with age. Misplacing something and finding it later can come with age. But getting lost in a familiar place can be a sign of something more serious, like a neurocognitive disorder. And losing memory such that it impacts basic daily life and functional impairments are the things we kind of look at clinically.
What does that testing look like? You mentioned testing. So if you go in and you think, my mom, or even I, lost my way to the store the other day, what does that testing break down to? What does it look like?
There's a few commonly used screener tests that can be done in the office with a primary care provider, with a psychiatrist, with a neurologist, or with a psychologist or therapist too. One is called the Mini Mental State Exam, MMSE, that maps out to a score from 0 to 30, and it's a number of different cognitive tasks. It tests things like memory, visual spatial recognition, and those different zones of the brain that are targeted by different types of dementia can sort of be picked up there. Another is the Montreal Cognitive Assessment, or MoCA, more commonly called the MoCA, and it's a bit of a more comprehensive test, a little bit more difficult test. It's still a 0 to 30. Now, neither of these tests is diagnostic on its own. They're both screening tests, and so they're to help us differentiate between, say, a mild cognitive impairment, normal age-related memory changes, versus, say, a dementia or neurocognitive disorder that is setting in.
So let's talk about some of the causes. It seems like there are so many families affected by this. What are some of the initial things that can cause a person to have dementia?
Sure. So when we say dementia, what we're actually referring to is a whole family of disorders, and they're mapped out more or less by a combination of cause and specific symptoms that they might have. A few examples: the most common type of dementia is Alzheimer's dementia, and that affects around 60 to 80% of the people who have a dementia of any kind. So it is the most common type of dementia, and that one comes from an accumulation of abnormal proteins in the brain, and leads to a fairly predictable course of memory decline and changes that you can observe in neurocognitive testing, but also in places like on MRI or CT imaging of the brain. Other causes are, there is a variant called frontotemporal dementia, and that can lead to a sharper decline in executive function with some personality changes. There are a few disorders like dementia with Lewy bodies. Lewy body dementia has a very specific pattern of findings. It can include Parkinson's-like symptoms that affect overall mobility and various muscle groups of the body, and also can come with visual hallucinations, changes like that. Parkinson's itself is associated with dementia. So a part of the value of the clinical encounter is to help differentiate what type of dementia is happening so that those causes can be addressed specifically.
You've discussed so many different types of dementia. We've really just scratched the surface. So we're going to continue this conversation. Dr. Murphy, thank you so much for being with us today, and we'll have more topics on this coming up. Thank you so much. Thanks for checking in for Monday Health Minutes.